All right, let's jump right in. Picture this. The kidneys, our body's incredible filtration factories, are in perfect working order. But then, kidney failure starts to happen. So how is that even possible? Well, today we're going to solve that exact medical mystery.
So here's the big question that stumps a lot of people. If the kidneys aren't damaged and they're getting plenty of blood, what on earth could make them just stop working? The answer, it turns out, isn't inside the kidneys at all. It's a problem with the plumbing after they've already done their job.
And here is our culprit. Postrenal acute kidney injury, or AKI for short. You can think of it as a classic plumbing problem. The kidneys make the urine, but it has nowhere to go because there's a blockage somewhere downstream. And that backup causes a really sudden, really sharp drop in kidney function.
Now, just to give you the bigger picture, AKI is generally broken down into three main types. You've got prerenal, which is a blood flow problem to the kidneys. Then there's intrarenal, which means there's actual damage inside the kidneys. But our focus today, the one we're investigating, is postrenal, the problem with urine getting out.
Okay, so if we know the problem is a blockage, the next logical step in our investigation is to figure out what's causing it. So let's take a look at the usual suspects, the most common culprits that can clog up the urinary system.
What's really fascinating here is how the location of the blockage can give us big clues about the cause. For instance, if the clog is in the ureters, those are the tubes running from the kidney to the bladder, it's often a kidney stone. If it's at the bladder outlet, a really common cause, especially in older men, is an enlarged prostate, or BPH. And finally, way down at the urethra, you're looking at things like strictures, or even blood clots.
And this is a really critical concept to grasp. Our bodies have a built-in backup plan. If you only block one kidney's ureter, the other healthy kidney can usually pick up the slack, and you won't see full-blown acute kidney failure. The real emergency kicks in when both kidneys get blocked, or if someone who only has one working kidney gets an obstruction.
So, a blockage is in place. What happens next? Well, it's not just a simple traffic jam. It actually triggers a pretty harmful chain reaction inside the body, and it's all driven by a dangerous buildup of pressure.
This shows the chain reaction perfectly. First, you have the obstruction, so urine can't drain. This forces pressure to build up backwards, all the way into the tiny tubes inside the kidneys. Eventually, that back pressure gets so high that it literally pushes against the kidney's filtration system, stopping it from doing its job. And if that continues, it leads to swelling, called hydronephrosis, and eventually permanent damage.
Now, the body doesn't just sit by silently while this is happening. It starts ringing some alarm bells. The most obvious one, a drop in how much you're urinating. A person might also feel pain in their side, what we call flank pain, especially with a sharp kidney stone, or just a general discomfort in their lower belly. These are all clues that something is seriously wrong with the outflow.
So the patient comes in with these symptoms, and now it's time for the medical team to launch their own investigation. How do they actually gather the evidence they need to prove that the problem is, in fact, a postrenal blockage?
You know, blood tests will definitely show that kidney function is down. You'll see high creatinine levels, for example. But that just tells us what is happening, not why. The real definitive clue, the smoking gun that solves this mystery, is found by actually looking inside the body with imaging.
An ultrasound is usually the first tool they reach for, and this is exactly what the investigators are searching for. Hydronephrosis, that telltale swelling of the kidney from all the back pressure. They might also see dilated or widened ureters and a bladder that's full and stretched out. Seeing these things on a screen is pretty much undeniable proof of a blockage.
So once that diagnosis is confirmed, the mission becomes crystal clear. You have to clear the path and get the system flowing again. This isn't about treating the kidney itself. It's all about relieving the obstruction that's causing all the chaos.
And the action plan is incredibly direct. Step 1 is immediate decompression. You have to relieve that dangerous pressure right away. And that can be done with something as simple as a urinary catheter. Step 2 is to go after the root cause. That could mean removing a kidney stone or treating an enlarged prostate. And finally, step 3 is all about supporting the body by managing fluids and electrolytes as the kidneys get back on their feet. And let me tell you, time is absolutely crucial here. Delaying treatment is not an option. A blockage that lasts too long can lead to really serious complications, like permanent kidney damage that can turn into chronic kidney disease down the line. That's why acting fast is so incredibly important. If you only take away one thing from this whole explainer, let it be this simple, powerful summary. The problem is the blockage. The diagnosis is made with imaging. And the solution, above all else, is to relieve that pressure, and fast.
So, when it all comes down to it, what's the real key to saving the kidneys in postrenal AKI? It's not some complicated drug or fancy new therapy. It's simply about identifying that blockage quickly and intervening to clear the path. It's about solving the plumbing problem before it can do any irreversible damage to the factory.